Hello, everyone. This is Dr. Marzban from Marzban Family Chiropractic and in Complete Injury Centers, calling and talking to you from Carrollton, Texas. Today, we're going to be talking about the diagnosis and how important it is. And on this slide, I show the spine of the neck, which we call a cervical spine, made of multiple levels of the vertebrae, and in between those, we have discs, and around the discs, we have the ligaments, and then we have nerve innervations and the vasculature flow coming in and going out, and then we have the skeletal muscles around it. And so it is very complex, and not only that, we also have to think about this region. It is under control of the brain, which is up here. And for any reflexes that we do in the neck, or if anything that we are trying to do that ourselves intentionally, brain is also involved with that, either consciously or subconsciously. And then we have the spinal cord, which goes through this vertebrae and the spine. And what I'm trying to get today is that if somebody, for example, comes with the neck pain, the neck pain can be due to multiple different things. And if I just strictly think about that, well, I have pain in the neck and this is the problem, or I have the pain in the neck because the muscles are the issues, or I have the pain in the neck is because of the vascular issues or the nervous system, or it could be the brain itself that causing that issue to be felt or the pain being felt. And for that reason, the clinician and the physician should be examine what is going on and just not sitting on the side and listening to the patient and looking at the MRI. They should be feeling and examining the area thoroughly and not taking it as a simple task. And I'm sure most of them they don't. And again, some may take it as simple. And again, many clinicians and physicians which are specialized in the field, some of them may only look at the areas that they are expert. And for example, if somebody has the neck issue and the doctor is a spine surgeon, maybe only looking into the spine and the joints. If somebody is the neurologist and is looking at the nervous system, which is giving the signals to the area, or somebody is the myofascial clinician, and then is going to be looking at the soft tissue and the muscles. And or if it is somebody as the again brain surgeon, maybe thinking about the brain is the issue. Or somebody who's the cardiovascular surgeon might be thinking the neck pain or the shoulder pain is coming from the area related to the heart. And again, I'm not saying that they all do that, but the thing is this is that even as knowledgeable a clinician and a physician might be, but they are not spending enough time to do the examination and find not only a diagnosis, but diagnoses, which the patient might have multiple different reasons to have that issue that is coming to the office. And for that reason, the examination should be done correctly and very carefully, and and find the cause or causes in order to get the treatments done. But again, in many fields, when the patient has the pain and the patient is suffering from intensity of that issue, the doctors and physicians and clinicians they try to mask the pain rather than, in addition to that, help the patient to uh, get the cause of the pain removed. And for that, the diagnosis should be done, and the masking the pain, which is important initially, but it should be followed by removing the cause of the issue. Again, removing a causal issue, I'm just showing that here is the mechanic that is working on a car, and the driver is complaining about the sound that is coming from the car. And either the mechanic is going to be masking the sound without fixing the engine, or it's going to be fixing the engine, which is causing the sound. And then fixing the car is important. And maybe the mechanic said that, well, I need to replace it. But the difference between the car and the human body or any living structure is that the living structures, they have the ability to fix themselves. And unlike the car, that car has these sensories, and it gives the signals to the computers, and it says that, well, there's a problem with the car, so you take it to the mechanic and try to fix it. But the body itself, like unlike the car, it has additional system to fix itself. And but sometimes it needs a boost, and that boost could be multiple different things. As the chiropractor, we try to align the spine and get the flow of the nervous system in an optimum way, that and also aligning the spine that is going to help the structure and the information that goes to the central nervous system, especially the brain, and including the cerebellum as well as the spinal cord. They are functioning correctly, and then the signals coming back from the nervous system, that's what we are trying to get to boost the recovery of the body. And that is very important in our field. And the other thing that I would like to add is that when you go to office, a medical office or the clinician office or any office that's trying to help you with the pain, making sure that they explain to you what is the diagnosis. And sometimes, even though you may not have the background in science and in medical field, you should try your best not to ignore that you don't deserve to understand what is going on, and how the clinician and the physician can help you with the treatments, and why the treatments is the reason to get the cause of the problem, not only the symptoms, away from you. Again, that's my take-home message, and I hope that you will have a wonderful day and rest of the uh, week or years. And you have a wonderful day. Bye-bye. Thank you.